Welcome to SROA Soundboard, a podcast for radiation oncology administrators. Here's your host, Tammy McCausland.
Hello, I'm joined today by Shannon Gregg, a keynote speaker, consultant, and self-professed tech geek. We're here today to talk about change management in the age of AI. Welcome, Shannon.
Thanks so much for having me on, Tammy.
Can you share a bit about your background and why you're passionate about change management?
Absolutely. I was working in the clinical research industry, working with clinical trial technology. And one of the things that we found is our internal systems were not always being adopted and used. And we found also that our technology was not being used at the site level. So I started really thinking about the psychology of users who were not putting what we thought was more efficient and effective technology into the hands of their users. So I started digging into it, Tammy, and found myself a whole new focus on my career.
And considering that we're in the healthcare space, do you have any personal experience in healthcare or in cancer care specifically that has shaped your perspective on change and innovation in healthcare?
You know, Tammy, I have spent most of my life working in healthcare IT and clinical research technology, thinking I know exactly what makes sense for all these people because I've studied it. And then in 2021, I went for a routine colonoscopy. And when I woke up, they told me, hey, guess what? We found a couple of polyps we were able to remove, but there is a rather large tumor and we've already called a surgeon. And tomorrow you are starting a protocol for treatment of rectal cancer.
But how did that personal experience make you think about maybe what needs to be done differently in healthcare and how they can innovate and change?
I know everybody's thinking about the patient in the middle and everybody's focused on patient care, but there are times that we get so caught up in the issues that we have: bureaucracy, politics, budgets, stress, and those types of things are impacting clinicians, administrators, and oftentimes we're forgetting the reason we want to do things better is so that we can service our patients and care for our patients better. And so I turned into a very vocal advocate of a patient, and I would say, hey, look, if it makes more sense for you to put me in this waiting room while you're helping these people who need this help, that's fine, go ahead and do it. Even if your system is telling you patient 1, patient 2, patient 3, right? I am able-bodied. I was able to walk into my chemo chair. And I think very often we forget about the experience on the other side because we're dealing with fires that are in front of us. And being able to think about that 360-degree vision, you know, our users, our people, our process, our technology, but then also what's the reason we're coming to work every day? Sometimes it's helpful to refocus on that.
So why was the psychological part important or not being utilized?
One of the things that we found in our practice, but then I also found in my research, is that human beings are always going to travel the path of least resistance. So people like to do things the way that they've always been done. And that goes all the way back to the way that our brain was formed in the caveman days. And even if you found something that worked better for them, that was more efficient for them, they had a tendency to say, this is the way that I've been doing it. This is the way I was trained on doing it. And I really am resistant to changing.
Is that even the case if they complain about something that they're doing and it's not working, they'd still rather keep doing what they're doing?
Of course they would, because they know it, they're familiar with it. And there have been many studies run on experiences that people have had where one that's pretty famous is in London in the subway, there was a strike. And so the strike workers caused the tubes to stop running. Many people found better ways to get to work: carpooling, biking, walking. And yet when the tube returned to service, people went back to their old way of doing it, even though it was not better for them. And I think that's the way that we're programmed. And that's why change management in any new rollout is really critical.
So why consider change in advance of implementing a new technology or initiative?
So one of the things that we find is people who are in the steering committee on a new initiative or a new technology rollout, they've been thinking about this problem for a really long time. So they have had plenty of times where they've debated how and why do we do this? What is the best way for us to roll out a new process and technology to our people? And by the time they introduce it to the actual users, they forget that that background information is also really important to bring people along on the change. And so the most effective technology or process rollouts come with communication and change management strategies that bring those people up to the same point that the steering committee is at.
And for leaders who feel overwhelmed by constant change, where should they start?
Some of the best things to think about in change management is quick wins. So very often we're looking at a very large implementation or a very large problem that we're trying to solve. And for the leaders as well as their constituents, it's best to find something that is small and quick that you can popularize with everybody who's receiving it and say, here's a little thing that we did, it worked. Here are 3 people who are finding that this makes their workday better. And so being able to think about it in small steps instead of one big bang often gives people the footing that they need for their initiative to really take hold.
And what is one mistake you consistently see organizations or leaders making when they try to implement change?
Very often people forget about the training, the communication, and then the different learning styles of their users. So they assume people will be excited to take it on and forget some people would rather listen to a podcast. Some people would rather watch a video. Some want to do kinesthetic learning and do a work along session. And so very often the people who are rolling it out forget to think about the way that different people will accept that change.
And so would you say that leaders should kind of spearhead the refocusing, or should they also task their people working for them all the way down to the front line to also think about that?
I think it's critical for leaders to set the table in this way, to say, here's how I am going to be thinking about this. If we've got a change or an initiative, there may be times that I'm a little bit nervous or I accidentally back into the old way of doing things. And I invite you to let me know about that. I also am asking you to come into this with an open mind. Let us know where there are bugs or things that are happening that you're not expecting, but we're going to get through this together. And many times, leaders who vocalize change is hard are getting better buy-in, better feedback, and better results.
That's great information. I'd like to pivot to talk about AI. Everybody's on the AI bandwagon and looking at creating efficiencies to help staff because we're experiencing a staffing shortage across all kinds of modalities or disciplines. So you have said that 85% of AI initiatives fail. Can you elaborate on that?
Absolutely. So a lot of people are treating AI as any other technology rollout. So a new EMR or EHR system, which it's tried and true, right? Cerner, Epic, they've been around for a long time. We understand how they work, and they've done a lot of research to make sure that what they've created is sticky and remains part of operations. For example, AI is so new that many of the tools that are coming are burgeoning. They don't have documentation that tells you here's how to do this. They aren't considering all of the different impacts of regulation, whose server it is on, whether or not we have accepted the safety, security of this particular application. Does it meet rules for HIPAA and PHI? And so a lot of times we see people who are very far down the path thinking this AI point solution is going to solve a lot of my problems, and then it has to be completely stopped because we haven't covered all the bases, because frankly, it's still very new. So what we see is leaders don't want to stop people from thinking in a way that's innovative, that helps with efficiency, but they also don't want to get themselves into a dark hole of regulatory compliance. The adherence isn't there.
What are some best practices administrators can use to roll out AI initiatives in their cancer centers?
So one of the things that really we have been seeing that is in research and also in application is thinking about, it's a decades old approach called human-centered design. People call it different things now, like design thinking, but creating user stories, even if they are brief, to say, as an administrator, this is what I want to do. As a leader, this is what I want to do. And from drawing out these user stories, it allows you not only to say, we know that this tool, this technology is going to work for us, but it also informs you how to roll it out in terms of training and change management, and then making sure that you keep using that system after it's rolled out, after the initial excitement has worn down. So really staying focused on the job to be done and the human who's doing it is going to help with making sure that your initiative works.
And how can administrators allay staff fears about AI? For example, AI agents replacing them, and especially about job loss.
That is one of the things that a lot of people talk about, but one of the best quotes I heard said, AI is not going to take your job, but people who know how to use AI might. So being informed and sort of pushing past that very natural fear to say, how can I use AI to take place of the tasks in my job that do not add value to my day? So if we're looking at scheduling software, does AI make sense? Sure. But when it comes to human interaction, AI is never going to be able to do that job for you. So using it as a tool to say, this is where AI can take away the things from me that are not value driven or value added, and instead saying, let me let AI do that so I can spend more time on what's actually important in my job.
So could you give an example of something where someone might be able to use AI and focus more on other tasks?
Sure. So some of the ways that we've been seeing AI being used is in patient communication. So we see a lot of people who are using communication tools that will say, based on these three things, we know that this is a good response. We've seen scheduling AI, one that I really love that I use myself, builds time in around your calendar if it sees an address in the calendar invite. So it will automatically say, oh, where you're going is 30 minutes away. And so it will put travel time around that scheduler. So those are some two very small ways that I've seen AI make big impact. Of course, organizationally, there are loads of tools that can get inside of your existing systems to say, here are some errors we see, here are some patterns that don't make sense, so that you can immediately look at it and say, uh-oh, we've got two patients that are scheduled for the same room at the same time because maybe we had two people sitting next to each other who hit the scheduling tool at the same time, and that wasn't built in there to say, this is a little bit of a mistake, or here's a patient who hasn't shown up for the last 7 times they were supposed to show. This requires a human phone call. And I think whenever you think about things that are transactional, those are the things that are really good candidates for AI.
Those are great examples. AI will require training and development. So how can administrators handle upskilling for AI, new hires with AI skills, etc.?
Upskilling for AI is something that's really critical that a lot of organizations forget about. Harvard Business Review did a whole magazine, a literal printed magazine, about a year ago that pulled out 5 imperatives for upskilling. And the first one was setting the table for the change. So making sure people know, here's how things are going to change. And then allowing people to have that training, but also feel like they can come back and ask questions. And this is where we see a lot of leaders forget, we're going to have to hold the hands of our employees and allow them to come and ask questions that they may feel silly about. They may say, I guess I should have figured this out from the first training, but this just isn't sinking in for me. Or it's a task I do so infrequently. Maybe it's a monthly audit log of hours, and I do it so infrequently that it's not part of my repetitive motion. So really saying, we know things are going to have to change. Here's how we're going to support you through the change with training. And then here's how we'll support you after the change so that you don't feel like you're left behind in case you forget how to do something.
So is it like a bit of an iterative loop where you do the training and then you do the follow-up? And how often should you do that follow-up?
So it depends on the change. So if it is something that is a very large scale change, I recommend that as often as you expect employees are going to log into it, there's a sort of inverted table on how frequently you should check in. So if it's a daily system that now has AI enablement, you're probably going to check in once a week for, 4 to 6 weeks. But if it's something they're only logging into once a month, then you definitely want to keep that check-in running for, 3 to 6 months. So looking at how frequently the interaction will be with the AI tool will help to prevent that employee resistance.
That's great. The other thing with change is the pace of change. And when we think about AI, things are moving so quickly. How can administrators and others working in radiation oncology keep abreast of all the relevant developments in AI, from tools to standards, etc.?
Yes, that is such a good and weighted question, Tammy, because there are so many and it's so pervasive and it's constantly coming at you. And one of the things that we know about healthcare is we're very good at planning. So we might have a 5 year strategic plan that says this is where we're going to consider changing the way that we do things. And AI sort of came along and said, you can't always plan for things like this. Just like COVID, when that came, that interrupted the way that we worked very rapidly, and nobody was prepared for that. And so for me, I literally have on my schedule every Thursday morning at 9 a.m., 1 hour that I set aside to say what's new, what's happening, and what are the things that I should be informed about. Now, I work with this every day, Tammy, so that might feel like overkill for some people, but thinking about your strategy and your roadmap and saying, I'm going to commit this to the calendar so I can think about making sure I'm enabling my employees, providing them the capacity and capability to keep moving forward, to be really excellent at the job they signed up to do.
And where should people go to kind of find out the latest news about AI that may be relevant to their work?
Well, I think there are academic journals that will support theories where they're running very specific tests to say, does this stand the test of time, or is this a flash in the pan AI tool that's going to be acquired by private equity and be completely changed by the time I get it rolled out? So I personally love Harvard Business Review. I think that's one that is very easy to focus on. But when I'm thinking about, this could be a cool tool, or I can be inspired by this, there is a website I really love called There's an AI for That. And you could type in anything like scheduler or email or anything that you're doing on a daily basis and see some of the new tools that are out there. It's got ratings. It's really fun. I love that one a lot.
That's great. Thanks for those suggestions. Precision, progress, and partnership, advancing radiation oncology administration, is the theme of SROA's annual meeting. How do you think these three ideas show up when organizations are navigating change, especially in a time of rapid innovation like AI?
I want to start with the precision one because to me that matches up the most closely with the golden triangle of people, process, and technology. And when you think about a triangle, it does have three very precise angles that say we want to make sure that we are poking holes in the right things. And the concept of this golden triangle, making sure that we are matching the process and technology to the people who are inside, is something that is not often very exciting to do, but the leaders who are focused on saying, I don't want to sit on a three-legged stool that bounces around. I want all three of these to be precise. That is critical. So I love that. And I think thinking about making sure that you're making the most precise choices for your team is so important. And the partnership reminds me of what you're talking about, Tammy, before about the iterative loop. If we don't have feedback that's coming back from our team, if they don't trust us enough to say, I don't understand how this works, this isn't working for me, it would be a little bit better if, that type of partnership is going to be critical to make sure that any AI initiatives that you roll out are really sticky.
And what about the progress part?
Progress is so critical. So measuring progress is critical. Asking people in a qualitative way, how do you feel about this? Or in a quantitative way, sending out a survey. Does this tool make your life better? How does it fit into the following initiatives in our department or organization? Really important, because then you use that to feed back in a partnership way. Here are the things that we've seen that are better. because we spent the time to roll this new technology or tool out to you.
You're going to be the keynote speaker at the 2026 SROA annual meeting. Can you highlight 3 things or topics that you will touch on?
I am thrilled to be joining everybody in Boston. I'm so excited about this. It is one of the only times in my life where I felt, look at my personal and professional life coming together in one perfect place. Of course, I'm going to talk about change management because that is so critical to think about all of the time. It cannot be reduced. In fact, its importance is more inflated as we're in the age of AI. I'm going to be talking about leadership strategies to make sure that any new rollouts, initiatives, or reformatted processes are approached. And of course, I'm going to leave with some academic theories and frameworks that can immediately be applied when everybody returns to the office.
Sounds very exciting. If you could leave radiation oncology administrators with one mindset shift around change, what would it be?
So the one thing that I would talk about if I'm leaving with one mindset shift around change is remember the human in the center, because very often we're thinking about the technology and how we can fit that into our organization, but instead shifting that teeter-totter to the human in the center will always help with your change strategy.
You've provided many insights that will be really useful today. Thank you very much for joining me today, Shannon.
Thank you so much for having me, Tammy. It was my pleasure.
Thanks for listening to today's podcast. To learn more about SROA, visit www.sroa.org.